Hi, welcome to Pathology Riddles. Today we will be dealing with the topic of cardiomyopathies. So what is cardiomyopathy? It comprises of the term cardio, myo and pathies. So cardio is basically heart, myo is the muscle, that is the cardiac muscle, and pathies are diseases of that muscle. It is an important cause of progressive heart failure and death. Now it can be divided into primary causes and secondary causes. So primary causes are the causes which are only confined to the myocardium or the cardiac muscle. And secondary causes are a part of a spectrum of disease, that is systemic disease like sarcoidosis, hemochromatosis, muscular dystrophies. So cardiomyopathies are broadly divided into three types. One is dilated cardiomyopathy, other is hypertrophic cardiomyopathy, and third one is restrictive cardiomyopathy. So what happens in these forms of cardiomyopathies? In dilated cardiomyopathy, as the name suggests, there is dilatation of the uh, heart. So this is called dilated cardiomyopathy. This is the most common form. Then there is hypertrophic cardiomyopathy. In hypertrophic cardiomyopathy, again, according to the term itself, there is hypertrophy of cardiac muscles. The muscle mass is increased. So this is called hypertrophic cardiomyopathy. The third form is restrictive cardiomyopathy. Then in this form, there is a restrictive layer, that is that it doesn't allow cardiac muscles or this heart to expand. So it is called restrictive cardiomyopathy. What is dilated cardiomyopathy? It is basically a progressive cardiac dilatation. Now, there is concurrent hypertrophy, that is, along with the dilatation, the cardiac muscles are hypertrophied also, but because there is elongation of the fibers, that is why the contractile function is lost. So, there is a contractile dysfunction. So, basically, it is a problem with systolic phase of contraction. Uh, while hypertrophic and restrictive cardiomyopathy have problem in the diastolic phase. This is the problem in systolic phase. So coming to etiology of dilated cardiomyopathy, 20 to 50% of the cases have genetic basis. So genetic cause is important. Then there is myocarditis, peripartum cardiomyopathy, then due to toxic cardiomyopathy, it can be idiopathic, that is, the cause is not known, in chronic anemias and hemochromatosis. So, these are the conditions in which you get dilated cardiomyopathy. There is mnemonic. Great monkeys perform terrifically in circus hall. So, this mnemonic can be used to remember all the causes. So, coming to genetic causes, there are more than 50 genes which are mutated in this type. Mostly, it is caused by autosomal dominant inheritance. There are causes which are X-linked, autosomal recessive, but these are minor causes. This mutation basically affects the cytoskeletal protein. So the integrity of cytoskeleton is compromised. That is why there is this elongation of the fibers. Myocarditis. Myocarditis is basically an inflammatory disorder which can lead to your dilated cardiomyopathy. There are some viruses which can cause myocarditis. So, if you demonstrate the antiviral antibodies, you could prove the infectious etiology. For example, Coxsackie virus and enterovirus. These can be detected in few cases of dilated cardiomyopathy. Peripartum. Peripartum time is basically the time around the childbirth. So, few days before the childbirth and few months after the childbirth, this whole time period is called peripartum. Many factors contribute to peripartum dilated cardiomyopathy. This may include, first of all, you can have hypertension associated with pregnancy, and this is a normal volume overload state, so that can also cause dilated cardiomyopathy. Then lot of nutritional deficiency because the child is basically taking up lot of nutrition from the mother. So there can be nutritional deficiency in the mother. So that can also cause. Then there can be metabolic derangement or an immunological response. So the defect in impaired angiogenesis in myocardium can also cause ischemia, leading to dilated cardiomyopathy. Toxic. So alcohol and its metabolites, that is acetaldehyde, they can also cause dilated cardiomyopathy. Then alcoholism also leads to thiamine deficiency. So you can get beriberi cardiac disease. Then doxorubicin is a chemotherapeutic agent and cobalt. These can also cause dilated cardiomyopathy. In cases of chronic anemia and hemochromatosis, there can be a iron overload state. So due to interference of iron with metal dependent enzyme systems or due to injury by iron mediated reactive oxygen species, there can be a dilated cardiomyopathy. Coming to the pathogenesis, as we have mentioned genetic causes and non-genetic causes. Basically, genetic causes cause defect in the contractile force generation and force transmission. Basically, cytoskeletal structure is weak, so this can lead to dilated cardiomyopathies again, which will lead to systolic functions as we have discussed earlier. In this, the ejection fraction is reduced to less than 40%. Normally it is 50 to 70% normal ejection fraction. So grossly in dilated cardiomyopathy, you will see an enlarged, flabby heart. There will be dilatation of all the chambers. The walls will be thinned out. Although there is hypertrophy, but because the cytoskeletal structure is compromised, so there is elongation. So all the walls of the chambers of the heart are thinned out. And there may be mural thrombi because there is systolic dysfunction, so blood is accumulated for a long time, so this can lead to thrombi formation, and these thrombi can move about, so they will cause thromboembolic phenomenon. Microscopy, there is nothing specific. Most of your cardiac muscles will be hypertrophied with enlarged nuclei. Many are attenuated, stretched, irregular. So basically, they are going to lose their normal architecture. There will be intestinal and endocardial fibrosis, especially in areas where already ischemia has taken place. In cases of iron overload, there may be intramyocardial hemosiderin. Coming to clinical features, due to ineffective contraction, the ejection fraction is reduced to less than 25%. So there will be heart failure and its symptoms are dyspnea, easy fatigue, and poor exertional capacity. It can also lead to arterial fibrillation, stroke due to embolism from intracardiac thrombi, which we discussed earlier, and this can lead to sudden death. Now, causes of death can be progressive cardiac failure and arrhythmias. Prognosis, it has a bad prognosis. Half of the patients will die within 2 years. Only 25% survive for more than 5 years. So, in the end, coming to treatment of dilated cardiomyopathy, patient can undergo cardiac transplantation or they can use long-term ventricular assist devices. This is all about dilated cardiomyopathy. We will be dealing with restrictive cardiomyopathy and hypertrophic cardiomyopathy in the next video. Please do like, share, and subscribe. Till then, this is Dr. Bismay signing out.